morning. My name is Patricia Fuller, and I work for Wellness Point. I'm a prevention specialist, and today we will talk about the danger and the effects of tobacco to the body. The reason why we are talking about tobacco is because tobacco is the leading cause of disease, disabilities, and death in the United States of America. As we go through this presentation, we're going to talk about the chemicals that's in smoking, what parts of the body that the tobacco affects, and also we're going to talk about what types of tobacco, the way tobacco is used. One way is in cigarettes, another cigars, and another way it is used as chewing. But now we know that now it can be used through vaping. And all of these ways are very dangerous to the body. And as we go along, we're going to talk about the chemicals. There's over 7,000 chemicals in the cigarette, in one cigarette. We know that it affects the brain because of the chemical nicotine that's very addictive to the body. The main chemical nicotine reaches the mind or the brain in 7 seconds after you smoke. 80% of children and youth who start smoking at a young age battle with the lifetime addiction of smoking, chewing, or dipping. So we're going to go over here and I'm going to talk about some of the reasons tobacco is so dangerous. Every year, 1 million deaths happens in the United States. And by the time of 2030, there will be 8 million deaths in the United States. Tobacco, what's in tobacco smoke? There's, like I said earlier, there's over 7,000 chemicals in one cigarette. And some of the chemicals are arsenic, ammonia, butane, cadmium, carbon monoxide, formaldehyde, hydrogen cyanide, methanol, polonium-210, and toothless. We know that rat poison, arsenic, is used to kill animals. This is in a cigarette. Tar. We know tar is used to prepare the roars and roofs. It's in cigarettes. Disinfectant. We know disinfectant is used for the bathroom. Disinfectant is in cigarette. Toilet bowl cleaner, which we use, especially women's, every day to clean our bathroom. It's in a cigarette. Butane lighter fluid is in cigarettes. Battery acid is in cigarette. And there is a chemical acetone which we use in fingernail polish remover. It's in cigarette. You find mothballs in cigarette. Insecticide, which is used to kill bugs and rodents, is in a cigarette. Now, the carbon monoxide from a vehicle is also in cigarette. And there's a chemical in gas that's called benzene. It's in cigarettes. Formaldehyde, which we also know as the name embalming fluid, which is used to preserve bodies, is in cigarettes. All of these cigarettes and more, all these chemicals and more are in cigarettes. And majority of them are cancer-causing chemicals. When we look at the teeth, this is tobacco juice with a teeth in it. And the teeth can be stained, your gums become infected, your teeth rot, and you can have sores in your mouth called canker sores. This is the effect of long use of tobacco. And we look at the lung. This lung over here on your left is a healthy lung. It's pretty, pink, soft, and it's spongy-like. But when we look at the lung on your right, it's dark because it has lung cancer or either emphysema. This is the danger that tobacco causes to the lungs. And we know we need our lungs to breathe. Lung cancer, asthma, bronchitis, pneumonia is the cause, most of the cause of smoking, dipping, or chewing. We look over here and we see that we can get cancer of the mouth, cancer of the throat, cancer of the larynx, cancer of the esophagus, cancer of the lung, the liver, stomach, kidney, pancreas, colon, bladder, cervix, rectum, and leukemia. These are the different types of cancer caused by use of tobacco. We look here and get a little closer. We see the lung real good, how it is damaged from a long use of tobacco. That's a lung that has cancer and emphysema. This lung here is a healthy lung. This is a damaged lung from a long time of smoking tobacco. And we also know that it causes respiratory disease. Smoking can damage the lungs and weaken the body's immune system. It can cause you to get pneumonia quicker. You can have acute bronchitis. You can have chronic coughing and wheezing. And it also can cause you to have COPD, which is chronic obstructive pulmonary disease. And then we go over here to this side, and we see that smoking can cause you to have cardiovascular disease. That means you can have heart disease. It can damage your heart, and it can also damage the flow of your blood to your vessels. And we know that the damage of the cells of that line, it would affect your flow to the blood from your vessels to your heart. That is a damaged heart. This heart has been damaged by a prolonged use of smoking. This heart is a good heart. And so it promotes the buildup of plaque on the artery walls. It increases the risk of blood cells, which can block blood vessels, from the blood from flowing through the vessels. It also can cause a stroke. And we know a stroke causes when the blood flow to the brain is interrupted. And because of the blocked artery, the brain damage, you can have brain damage, paralysis, or death can be the result of the stroke. The coronary heart disease. The coronary heart disease refers to a disease of the arteries that supply the heart with blood, and possible complication of these diseases including heart attacks. A heart attack occurs when the blood supply to the part of the heart is blocked. And it could be a heart attack, and it could be very fatal. Then we have a problem with abdominal or aortic aneurysm. That means the artery to the body's the aorta is the largest body's artery. And it's in your stomach, and it will block the flow of blood. Then we talk about the peripheral artery disease called PAD. And it refers to the disease to arteries that carry blood outside the heart to other parts of the body. And this can be very dangerous if you're a smoker and you smoke every day. Smoking also increases the risk of sexual and reproductive problems. It can cause cataracts, type 2 diabetes, gum disease, peptic ulcers, and bone fractures. Now we want to talk about secondhand smoke. What is secondhand smoke? Secondhand smoke is a mixture of the smoke exhaled by a smoker and smoke from lit end of the cigarette, cigar, or pipe. It contains the same dangerous chemicals a smoker inhales. So, if you're not a smoker and you're around somebody that smokes, there's a chance that you can have all these diseases and without even smoking. Breathing even a small amount of secondhand smoke can be dangerous. The dangers to adults. It can cause lung cancer and may cause other cancers. It can damage your arteries and causes heart disease. It can cause chronic respiratory problems and dangerous for infants and children. Because their bodies are still developing, infants and children are especially vulnerable to secondhand smoke. Secondhand smoke can increase the risk of low birth rate if a mother is exposed during pregnancy. It can cause sudden infant death syndrome, which is SIDS. It increases the risk for respiratory illness, including bronchitis and pneumonia. It triggers asthma attacks. It increases the risk for ear infection. So the benefits of not smoking, the best way to avoid the effects and hazards of smoking is not to smoke at all. Because smoking is deadly. Smoking is very dangerous. It can cause you to premature, your skin to look, you can age early. It can cause you to, your teeth to be yellow. And like I said, it causes lung disease. It causes cancers. It can cause bronchitis. It can cause asthma. It can cause pneumonia. Your kids can have ear infection. So smoking is dangerous, not only to the lungs, but it's also dangerous to the brain because you can become addicted from the use of the nicotine that's in the cigarette. Thank you very much.